We'll be like two sweet peas, and we'll be the seamlessly heart-swept, and we'll be the great adventurers, and we'll be undefeated. If you stick with me, then I will stick with you. If you can stick by me, then I can stick by you all the way through.
Welcome back to Her Rules Radio. I'm Alexandra Jameson, your hostess, your health, life, and success coach in your earbuds. So today I think she must be my gold star returning guest expert. I have my dear friend, Dr. Anna Cabeca, here on the show to talk about hormones, to talk about trauma and sexuality. This is such an important episode. I keep having Dr. Anna back on the show because she is truly one of the most expert, holistic doctors out there when it comes to women, our hormones, our energy, our focus, our bodies, all the changes that we go through as we approach and enter and start to go through the changes of middle age, whether it is perimenopause, down and dirty in the menopause, whether you are just dealing with changes in your relationship. A lot of people, most people, I would say, go through that change from the, really intense hormonal sexual attraction with their partner. And after a few years in a long-term relationship, they start to miss that. And it's no one's at fault, but there are things that you can do to reignite that. And not just for your partner, but also for yourself. So I have Dr. Anna back on today, and we're going to talk about these really important topics. What happens to us women as we age hormonally? We struggle with focus, with self-esteem, with energy. We feel our grit and resilience falling off. We feel like we're not as attractive because our internal sexual drives have fallen off. And all of that can be addressed naturally, holistically. And it's not just about the body and what you eat, although that is a big part of it. And Dr. Anna, in her best-selling books and her very popular programs, which we'll talk a little bit about, she really goes into all of those details about what to eat, how to change your habits, how to support yourself and resource and nourish yourself better so that your body can respond and feel the way that it used to, or feel even better than it ever has before. So we really explore some of the emotional aspects of sexuality, sensuality, desire as well. We talk a little bit about sexual healing in terms of, a lot of us are walking around with past trauma. And that can show up as a block when it comes to enjoying our bodies, feeling safe in sexual relationships, feeling safe in our bodies, period. So there's a lot of ground to cover. And one of the main reasons why, I just love Dr. Anna. Truly, we've been friends for years now. And I trust her 100%. I'm very lucky that she's there for me personally. And she is also there for all of you, too. But what I see is that as we reach middle age, a lot of us, myself included, we feel this drop off of drive and energy and focus that's so related to our hormones and our sexuality, sensuality, etc. And it changes over time, and that's fine. But we still have so much that we want to do. We have projects we want to create. We're rediscovering our artistry. We're rediscovering our inner creatrix, and we want to accomplish all these ideas. We want to bring them into being in this life. And sexual energy, that natural, some say divinely given energetic spark that's in us, is a huge fuel for our creativity and how much we're able to accomplish with joy in this life. So I believe that balancing our hormones and restoring our natural drives really it supports our long-term relationships. It supports our self-worth, our creativity, everything that we are, everything that we do in this life. So if you're struggling with hormones, sexuality, sensuality, any of this is a great interview for you. And we're going to be talking about a couple of programs and products that Dr. Anna offers. I personally endorse them. I use her products regularly. She has a great offer. You can get her Julva cream, that's spelled Julva, and you can go to bit.ly/radio trial, and you can get a sample of her Julva. It's a trial pack, and this cream is specifically for vulva health. I cannot tell you how much I love this product. I told her she should call it the female Viagra. It works directly on the tender skin, but also on the muscles of the vulva. This is such a valuable product. I really encourage you to try it if you're experiencing any physical, weaker muscles in your vulva or more tender skin in your vulva. These are hard things to talk about, but Dr. Anna brings so much heart and compassion and real science to this. So I highly encourage you to go to bit.ly/radio trial. And we're also going to be talking about her sexual CPR class that you can sign up for and do online. Again, you get her best wisdom and incredible guidance. And her sexual CPR course, you can get that. Go to bit.ly/radio CPR, all one word. We'll include both of those links in the show notes at herrulesradio.com. You can just go to this interview, check out the show notes. You'll find both of those links. Now, sit back, enjoy, maybe grab a pen and paper or a blank document to take notes. Here's me and Dr. Anna. Dr. Anna is back. Dr. Anna Cabeca, thank you so much for being back on Her Rules Radio.
Alex, I am thrilled to be here.
You are our gold star, most often returned guest.
It is an honor. It is truly an honor. Plus, I love our conversations.
I do too. I always learn so much. And I'm always here for the free advice too. But I love hanging out with you. And we're going to be talking about one of my favorite topics. We're going to talk about sex drive, sexual pleasure, reconnecting with our pleasure as women, hormones, all of those things. So are you ready for me?
I am ready. And oh my gosh, just total flashback to our first conversation. And it was the most open, vulnerable, authentic conversations that I can literally say that I'd ever had at that point in my life. And just like you were all on board, like, let's talk about self-pleasuring. Let's talk about, the vulva. Let's talk about orgasm. Let's talk about these things that women don't want to talk about necessarily. And it was, we just have to go back and listen to those days again too.
Yeah. So listeners, go back and just listen to all of my interviews with Dr. Anna. So we're going to talk about kind of a sexual CPR program that you have. And there's a lot of topics to cover in this conversation. But I also really want to go back to what brought you to this work, because this is not just the work you do in life. You are a passionate advocate for women's health. So tell us a bit about yourself and what brought you to this point.
Yeah, definitely. And one of the things that brought me here is absolutely my own life journey. I've always been a women's health advocate. I saw my mother suffering when I was a young teenager, suffering with heart disease, suffering with hormonal issues, suffering with diabetes. And she was only in her her 40s and early 50s requiring heart surgery, and just saw the difference between medical advice based on research done on men being applied to women. And I had red flags all over the place thinking that's not correct. And then in my own personal journey, being diagnosed with early menopause at age 39, after, our own traumatic story in my family, we lost, Alex, this so well, we lost my son in a tragic accident, and he was only 18 months old. And, I was still breastfeeding him. And that, was obviously devastating. I mean, devastation upon devastation. And I had dealing with grief and despair and just the uncertainty of what the next days would bring, but also looking back and being able to intellectualize the physiological changes that occurred. I mean, from breastfeeding 1 minute to never having another drop of milk, Alex. And when you breastfeed, like if you miss a feeding by 10 minutes, your breasts are engorged and your breasts are full of milk. But that never happened. My breasts were like literally empty socks from that moment onward. And the physiology of stress creating hormonal mayhem. It plunged me into an early menopause at age 39, and I was given the diagnosis of irreversible infertility. So early menopause, irreversible infertility at a time when my husband and I wanted desperately to have another child, not to replace our son, but because we love children, and also to just fill this massive void for myself and my other daughters. And so it was devastation upon devastation. And that literally took me on a journey around the world. I call it a healing journey. And it just opened my mind to other modalities of healing that I hadn't learned in medical school, that I hadn't learned at Emory University in my OBGYN residency program. But I was able to implement in my own life, reverse early menopause and become pregnant and deliver a healthy baby at age 41, the child I was told I would never be able to have. And she's making noise in the other room right now. And she's 11 and I'm 53 this year. So, healthy hormones are a must. But a really big part, Alex, was that even though I was able to heal physically, the underlying PTSD, I wasn't aware of the trauma that was causing me. And that underlying PTSD has created this cortisol oxytocin disconnect. So cortisol, we know, is the life-saving stress hormone, but too much, too long, or not enough can really deplete us and cause us to burn out. At the same time, oxytocin gets depressed too, essentially gets burnout as well. And so we have low oxytocin, low cortisol. And under the surface, what that feels like is disconnect, is disassociation. So looking back, my husband and I knew that over, the average population experiences 50% divorce rate. But those of us who've experienced the loss of a child have over a 70% divorce rate. And we didn't want to be that statistic. But despite that, we ended up in divorce in a very unhealthy way. And I can look back and know that if I knew then what I know now, what I teach in sexual CPR, which is much more than about sex, but it's about connection and intimacy more than anything. But if I knew then what I know now, maybe my marriage would have lasted, or maybe it wouldn't have ended in such an unhealthy way. So that cortisol oxytocin disconnect is something that I discovered not through textbook, but through my own healing journey, and really helped me understand the behavior, the self-medicating behaviors, the crazy that I also experienced.
Yeah. And I have to go back and underline something that you said, the disconnect that we feel from our sexuality, because we're going to go into some of the reasons, the biological reasons, the nutritional reasons, the lifestyle reasons, why we feel disconnected from our sexuality, from our sensuality. But we have to go back even further. And one of the main areas of healing, in my belief, is that most people are walking around with unhealed trauma from as early childhood. Even we genetically have trauma from our mothers, from our grandmothers. Things that happened before we were born affect us genetically. But especially the things that happen to us when we are young, when we are developing, and even the traumas that happen to us as adults, they have a physical impact on us. And those traumas, they can't necessarily be healed through talking, although talk therapy is incredibly valuable. I've been in therapy on and off since childhood. I go now, and it's a self-care thing. But these traumas are really happening at a physical and energetic level. So can you talk a little bit more about how trauma relates to our sexual disconnect?
Absolutely. And, even more than this is just in general, like you said, even in the womb, even before the womb, right? The conditions of our genetics and our lineage can really affect us, and especially in the womb. One thing that I learned through my worldwide journey and speaking with healers from all different modalities, I didn't discriminate. I was going to take what resonated and leave what didn't. And I spoke to shaman and Indonesian healers and some of the world's leading scientists. And I just needed to understand, what the heck is happening? And one of the things is that question I learned to ask my patients is, what was the condition of your mother in her pregnancy with you? So how did she feel about the pregnancy? Was she a single mom, stressed out or in fear, or, what was going on in her life, and how could that have affected your early, your first imprinting, essentially, physiologically, and how that can affect us. But then I realized, so there's that aspect, but then there's this aspect, age 35 to 55, Alex, that I call this period that I recognize as a neuroendocrine vulnerability. No one's explained this. This is not taught in medical schools. This is not taught in our residency programs. And I'm a women's health expert, right? I was never taught this. I had to learn this and discover this. But this age 35 to 55, neuroendocrine vulnerability. So what I recognize through the research, because trying to understand what happened to me, why did I act out of character? Why did I experience these things that I experienced, not just physically, but mentally and spiritually, emotionally and relationally, all these aspects. And what I recognize, this period when we're losing that neuroprotective hormone progesterone, which is the hormone that we commonly associate with pregnancy, healthy pregnancy. Progesterone is progestation, pro-life, essentially. It supports the hormone that creates a nourishing environment in the uterus to support and hold a pregnancy. But we need it beyond pregnancy, beyond reproduction, for our brain, for our breast, for our bones, and certainly for mental health. But this progesterone level starts to decline mid to late 30s, and with it, estrogen and our other reproductive hormones. So what happens here, because progesterone is brain protective, what we see is that those of us who have had adverse childhood experiences, we call it ACEs, adverse childhood experiences, or post-traumatic stress, trauma of any sort, sexual abuse in the past, any sort of trauma, when we lose this neuroprotective layer somehow, we experience this perimenopausal transition in an extreme way. We have more symptoms, more menopausal symptoms, more hot flashes, more difficulty with sleeping, more anxiety, more depression, more, drug addictions, all of those things we can experience. But knowledge is powerful, right? When we know it, we can treat it, right? We can address it, and we don't just think, well, I just went crazy. And I think everyone listening can think of either an experience in their own lives or experience in a friend they knew or care about, and say, well, after, maybe it's years after she had a trauma, but, this time period, 35 to 55, she was out of character or compensating. Maybe it's affairs, gambling, drinking, shopping, excess, you can help me list some of these self-medicating
all the things you know.
Right? And addictive type self-medicating, and I've done all of the above, right? And in that, I didn't realize that it was just that kind of self-medicating. What we're trying to do is increase oxytocin, increase dopamine, increase the hormones that help us feel better. So that's those stimulating activities, whether it's sex, sexual affairs, whether it's shopping, binging, or analgesic type of things like drinking, overeating, and things like that can really numb us, so to speak.
Yeah. Now, I got to put a highlighter around what we just said here about the ACEs, the acute childhood experiences, these traumas. And this is big stuff. Even looking or taking one of the ACEs tests can be re-triggering for people. So, do not enter into this lightly. Sometimes you need to have like a professional kind of guide you through these things. But the things that happen to us in our lives, the emotional, spiritual, energetic, relational traumas, absolutely have a physical effect on us. Now, Dr. Anna, I've actually just recently, for the first time, took the ACEs test myself. And because especially of, our family had a lot of addiction and mental health and several suicides before I was 12, I didn't realize how high my ACEs score was going to be. And with my professional guidance, I was able to see, oh my goodness, like this lifelong journey that I've been on, right? You're talking about your healing journey. You and I have both been on this in our own ways. And there is always something that you can do. There is always healing available. It's not, this is not a sentence like you're not destined to have early disease because of these things. But having that knowledge is so powerful. And I love that you weave this into your sexual CPR work. So I just have to honor you for highlighting something that does not get enough attention.
Yeah, no, I wish it did, because I probably would have had a much easier course, And I think that's true for so many of us. It's like the eyes don't see what the mind don't know, right? The eyes don't see what the mind don't know. And that's really important to understand. So if we can look at this and say, okay, well, what's really going on? And you're absolutely right. These ACEs, whether from childhood or beyond, the traumas in our life, understanding that because just the physiologic effects of the perimenopause transition is, let's say, a reawakening of some of these things. And the traumas, the bad and the good, let's call it a reawakening. And this is a time for us to honor them and deal with them and get the help we need. So therapy, EMDR, emotional freedom technique, all of these are ways that I certainly have needed to rely on. And then what I write about in my book, The Hormone Fix, is the keto green way, empowering brain clarity and a peaceful physiology so that we can experience our present day life in satisfaction, in joy, in peace, and a high amount of clarity and wisdom that I believe is our rites of passage. I mean, heck, we put up with the first 50 years to get here.
We've paid our dues. Let's have some fun. So I love this. Now, there is healing to be done, and there is fun to be had. There is joy and pleasure still. And why is it such a relevant topic to all women, regardless of how much sex they are?
Yes, absolutely. And it's terribly therapeutic in the right circumstances, right? And this is something that I recognized, Alex, is because part of my journey is like, why was I sex seeking? And sex is one of the most powerful ways that we can increase our oxytocin level. oxytocin, the most powerful healing hormone that we have available to our body. It is the hormone of love, bonding, and connection. I know you are an oxytocin fan, and we have dug deep into oxytocin, you and me, as well as you have in so many areas of your work. But this oxytocin hormone, this healing hormone, this connecting hormone, and, honestly, the research shows, and it's an anti-aging hormone. It helps regenerate muscles. People with healthier levels of oxytocin are associated with healthier longevity, healthier, longer marriages, and other things that we do that increase oxytocin. For example, even in our very old age, in our 80s, having a pet, we know having a pet increases oxytocin. There's playfulness, there's caring, there's love. That increases oxytocin, and that's also associated with longevity and better quality of life, lower number of medications, and decreased risk of hospitalization or nursing homes. So that's pretty powerful, right?
So amazing.
So sex is one of the biggest ways that we certainly can do this. But beyond the oxytocin, we get that from orgasm. Orgasm is a powerful way to get oxytocin. But other ways we get oxytocin: hugging, kissing, laughing, playing, thrill-seeking behaviors, yes, so hence the, gambling, shopping, other ways that we can increase oxytocin.
But what I love is when groups of women get together, like when you get together with one plus more of your girlfriends and you laugh or emote in any way, like you could feel you could spoon it up out of the air. It's in the air, right?
It's in the air. It absolutely is, which it brings me to think about, how we always talk about a glass of red wine, that's longevity producing. And I always ask, is it really the glass of red wine? Because if we're sitting at home drinking a glass of red wine, is that really increasing our longevity? No, really, because we know that alcohol in general is going to increase inflammatory markers, decrease our restorative night's sleep. But what is it about getting together with a glass of wine and your best girlfriends or friends and family, and you're laughing and having fun at a table? That's oxytocin. That's more than the glass of wine.
Oh, seriously. And it's a chemical bond. It's how we bond. It's why your friends feel like your family.
Yes, and men and women receive oxytocin differently, and I talk about that in sexual CPR, and that's really powerful. Couples need to really understand that. And Alex, I've worked with so many women who've had cancers in the past, like breast cancer, or just in menopause or beyond menopause, or in marriages, and feel like, I love my husband, I just don't want to have sex with him. Like, what's wrong with me? It's nothing that's wrong with us. So I teach this in sexual CPR because it's important to understand two really main things. Number one, that if the man in our life wants to know what makes us happy, and our pleasure is his pleasure. That's like huge for us to realize as women. Mm-hmm. We need to listen to that and accept it and voice what makes us happy. Not what doesn't make us happy, because that can take all day. Just voice what makes us happy and really start focusing on that, what he does to make us happy, and especially in the bedroom, especially in intimacy, because there is no area in our lives that we are more vulnerable and capable of being shut down. And that goes for both men and women. So we have to voice with our sexual voice, what makes us happy, where we feel pleasure, and take that outside the bedroom into our daily life and existence. And that is powerful. That's one of the secrets that men and women need to know about each other. But women need to hear the secret that his pleasure is your pleasure. So you are not to check off a to-do list to have sex. You are there to increase your pleasure. And the second really important point is that secondary sexual response is natural to us as we grow older. And after we've been married for 2 years. Secondary sexual response, what does that mean? I'll give you an example. Patients would come into my office and they would say, Dr. Anna, I don't initiate sex. I have no sex drive. And I would ask, well, once you get started playing with intimacy, how do you feel? Oh, then I'm good to go. Once we get started, I'm good to go, my patients would say. But that's secondary desire.
Yes.
And that's normal. So all we have to do is be receptive. And in order for us to be receptive, we need this other really big secret. And I teach this in sexual CPR in much more detail. But that is to know that, we need to communicate to our mate that oxytocin makes us want to bond and connect. So after sex, we need this connection time period. So let me give you another example. I just flared up in my mind a patient, because I always treat, when it comes to sexual health, treat the woman with their husband. Now, I've retired my clinical practice, but husband came in with his wife, and he said, Dr. Ann, I mean, you've helped her with her hormones. She's got great sexual desire and responsiveness. She has orgasms, but she never initiates sex. What's going on? And my question to him was, well, what do you do after sex or after you climax? What do you do? Well, I roll over and go to sleep. I'm like, there's the problem. For men, oxytocin makes them tired. They want to roll over and go to sleep. They're done. Physiologically, they're kaput. They're satisfied. You're satisfied. He's satisfied. Boom. He's out. He's tired. Oxytocin makes them sleepy. For us, it is the hormone of connection. And oxytocin has a longer, let's say, half-life in our bloodstream for whatever reason than men. And I'm not exactly sure why. I haven't figured that out from the science. But we have this need to connect, to bond. So I told him, as I tell men and I teach in sexual CPR, is that just give her 2 minutes of time to cuddle or connect. Otherwise, we can tend to feel used, like check, and then like he's checked us off and he's done, and we can feel used. And that's like, I don't want more of that. I don't care how many orgasms or whatever I've had. What I want is the intimacy, connection, and bonding. And according to the research, that's what most women want. And giving us that time of nourishment, of authenticity, of connection, of intimacy, that will make us want to be more receptive to have playtime, have sex, as well as initiate sex more.
Now, there's another main difference between, again, most women and most men. Everyone's different. But women, especially as we age, as we get closer to perimenopause and menopause and post-menopause, all the flavors of menopause, we really struggle with vaginal health. Men have Viagra. They can just pop the little pill and they get an erection and they don't need to worry about anything. So let's talk about what's happening for women as we age. Women can feel more and more tender in their vulva. We lose lubrication, where our muscles lose strength as well. So tell us what's happening and what are some of your solutions for these issues?
Yeah, and this has been a really huge part of my teachings and realization. Definitely as we age, we lose the elasticity to the vaginal area, to the vulvar area. We tend to have more dryness, decreased sensation, loss of orgasm. But worse, we have discomfort when we have sex and even pain from the dryness. So, and many women will experience discharge, odor after sex, or urinary tract infection. So if we experience discomfort, urinary tract infection, odor, any or all of these things, why the heck would we want to have sex? Right? Why the heck would we want to have sex? It's like, if you're, for a guy, for example, and this is good to explain, for a guy going up, if he's playing baseball and he goes up to bat and every time he's up at bat, he gets hit by the ball. Why the heck would he want to play baseball, right? He would not play. Well, that's how it is for us. So that's negative feedback. Why would we even want to? And as a gynecologist and a scientist, I recognize that number one, there was no clean, safe, over-the-counter, chemical-free option to help us with, number one, lubrication, but also as an anti-aging formula. That's where I created Julva, and you're one of my early implementers of Julva. And
I'm a huge fan.
Yes, you've done so much to spread the word and help so many women and the men who love them. And so Julva, just because the reason Julva works so well is many of the ingredients work really powerfully together. But as we age, we're losing our reproductive hormones that help the elasticity of the vaginal canal. Now, of course, we need this elasticity when we're giving birth. I delivered almost 9-pound baby, right? Through 4 children through my vagina, right? Many experience these, experience the flexibility of the vaginal wall. And in general, at rest, the vagina is not big or long, but with stimulation and with foreplay, and it takes time, even more time as we get older, the vagina can engorge and increase blood flow, increase elasticity. But when we lose these hormones, there's less elasticity. It's harder and, it's more uncomfortable. There's less stretch, less rugation, less natural glands, less natural moisture that is coming from this vaginal tissue. And this is a consequence of the hormonal decline. So when we add back some supportive ingredients to help rejuvenate the pelvic floor, like, for example, what I've included in Julva, the plant stem cells from the alpine rose, which are regenerative, DHEA, which is, powerful, and emu oil, coconut oil, and shea butter, which are great lubricants, plus have their own special natural effects on our body that really can make a huge difference in how we feel. So vaginal hormones can be prescribed as well, like vaginal testosterone, vaginal DHEA, and it totally reverses the effects of aging. And many women are experiencing this earlier and earlier. Like we know, women are experiencing menopause earlier and earlier. Mid to late 30s, we're seeing this perimenopausal transition. It's not like we wait to age 50 and then we're in menopause and we're done. No, we're seeing it in our 30s. And what's happening, that deep decline of progesterone that I talked about earlier, this deep, rapid decline of progesterone is in the receptors of our fascia. So the stiffness, if anyone experiences a stiffness of their joints, arthritic symptoms, that can often be identical progesterone. Well, first of all, increasing our body's own natural production of progesterone through herbs, through meditation, through anything that we can do to decrease cortisol, because cortisol robs our progesterone. So cortisol, stress, anything we can do to mediate that is going to increase our natural hormone levels. And then using bioidentical progesterone, which I feel really that most of us over age 50 benefit from bioidentical progesterone. That in and of itself can really help. So these vaginal changes that we're experiencing as we age can be reversed. And what's beautiful as you start paying more attention to our erogenous zones and to the sensitivity that we're recreating in our vulvar and vaginal area too, we can increase the amount of pleasure that we experience. I know women who have not had pelvic orgasms, experience pelvic orgasms in their 40s and 50s and beyond. And then women in their 70s still having sex once a week as part of their, intimacy, their,
it's quality of life.
Their marriage,
engagement, it's joy, and it so impacts our health and vitality. And one thing that I want every woman and non-woman who loves women to understand, I want you to hear this. Like, Dr. Anna, you and I really agree on this, that sensuality and passion are not dirty or bad. That our bodies were designed for pleasure, correct?
Absolutely. We are designed for pleasure.
We are. And, there are a lot of things that get in the way of us being able to enjoy our bodies as they were designed to be. And that can, we've talked about the hormonal. I know you go into great detail into the nutritional, into the dietary stuff, and we've covered that in our past interviews. So I do want people to know, like, this information is out there in our past interviews, and you covered at great length in your sexual CPR course. But I do want to kind of end on this note that sensual, passionate, pleasure, these things are deeply important to you. And you, that's what you're here doing. That's what your course is about. It's about helping women find that, get comfortable with it, expand it, and really bring it fully into their lives.
Absolutely. Alone or in partnership, right? And it's recreating that femininity, like igniting the spark that's within each and every one of us, whether we do it for our relationships or whether we do it for the passions that we have in our life, whether it's the goals we set for ourselves, the hobbies we love, the journeys we want to take. I mean, vitality, that's the spark. Our sexual energy is magnanimous. It can be experienced in so many ways. So beyond our, certainly beyond our most intimate relationship, this energy, this reviving our feminine energy is really powerful. And I think society has come a long way to try to snuff that out. And we need to reignite it. And we need to reignite it through awareness, through acceptance, through communication, through love.
Yeah, self-love. For sure. And as you're talking, I'm just thinking about the benefits of your work. And we're going to encourage people to go check out your sexual CPR course and the products. I use Julva regularly. I just had some of your Mighty Maca Greens earlier today. So I am a huge fan of Dr. Anna and her products and information. But the benefits to this are not just about pleasure and intimacy, although they absolutely are. I have to credit the things that you're talking about with, being able to maintain my energy so that I can create new things, so that I can feel like I have autonomy, right? That I am directing my life, that I'm not falling under, like not falling apart and not able to direct my own life, and also be of service, right? That I am doing better for myself and I'm doing better for the world. That's what this stuff is about.
Absolutely. Absolutely.
So let's wrap up with a little description of your sexual CPR course. I'm going to put all of the links to your products and your programs in the show notes. You cover a lot of territory in this course. So it is holistic. It is exciting. It's an adventure. And people are going to get a lot out of it, yeah?
Sexual CPR is really this beautiful holistic program to really help you ignite the fire that is within each and every one of you and all of us. And I start with my first class, which is, called 911, Help Doctor, my sex drive has no pulse. And I go into the really 7 key areas that can be blockages to our sexual health. And I give a questionnaire. Now, let me just say, in my program and in the course, there is pearls for absolutely everyone, plus 100% money back guarantee. I want you to learn. I want you to open your mind to the possibility. And I guarantee that you will love it. And if not, I'm happy to refund you 100%. So in my
That's
first...
amazing.
Yeah, of course. I know too how valuable this program is. And from so many testimonials. But one of the things that I teach, and I created a handout that goes through these 7 key areas. And as I started having, my patients had come in and I created this course and this handout, I built this over years, but I said, fill out this handout and bring it back in and discuss it. And so many times patients would say this in and of itself has been eye-opening and has, despite years of therapy, uncovered these areas that needed to be addressed in their life, or be able to say, it's an issue that I'm having right now in this situation with my partner, or this issue that has come up from my past that I really need to deal with. So this worksheet that I created, it's a 3-page worksheet. It's questions and exercises that I want each individual to complete. It doesn't take long. It will take less than, 30 to 40 minutes, but it is, and it can take longer, certainly, depending on how much comes up in you, but just opening areas of possibility in the 7 key areas that tend to be the reasons why we have blockages to our libido, to our sex drive, to our joy, to our passion. And that's the first class. And the second class, I go into hormones so you can really understand the waxing and waning of our hormones and really what, maybe you're going through right now or what you went through to help understand these hormonal changes and how they affect you. And then third class, I go into anatomy, physiology, the erogenous zones, the G-spot, and a beautiful way of explaining, expressing, and teaching you things that you definitely didn't learn in school, that your mom didn't teach you, you don't even get in tableside conversation, to really understand your anatomy and how it can work for you versus against you. And then the fourth class I teach is orgasm, oxytocin, and the brain. plus I have some special guest interviews for men's sexual health with Dr. Jeffrey Life, and we go into men's sexual health, how erectile dysfunction can affect our partners, and this is a class that every man needs to listen to. So Jeff and I go into details, and then also I have a great conversation with John Gray, who wrote Men Are From Mars, Women Are From Venus, as well as a special interviews with Diana Kirshner and Ariel Ford from Soulmate Secrets. And I always say, Alex, I am the sexual health expert. I am not the relationship or technique expert. So I brought in Michelle Alva to teach us to orgasm even fully, to enhance our feminine orgasm. So it's really a fun, holistic program. And without a doubt, there are many aha moments that everyone listening will experience that will stoke our fire, so to speak, and help us appreciate ourselves more, our femininity, and our mate even better.
Thanks for listening to this week's episode with Dr. Anna Cabeca. Again, definitely go check out her incredible products and programs. You can go to bit.ly/radio CPR for her sexual CPR course, or bit.ly/radio trial for the Julva Trial Pack. 2 fantastic products. Thank you so much for listening. Just a little reminder that this is our 5-year anniversary here at Her Rules Radio. I hope that you find the show inspiring and that it serves your needs and desires. And hey, if you haven't yet, go on over to iTunes, leave a review, put up that little 5 stars and leave a little review, a few words about why you love the show. It really helps other people to find us and find the show. Thank you all so much for being here. Have a great week. We'll be back next week. Mwah.